Welcome to The Blend, a podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. In this episode, Dr. Apple Bodemer, a dermatologist at the University of Wisconsin, and Dr. Sonal Choudhary discuss the use of JAK inhibitors in alopecia, including how they monitor patients who are taking these medications. They also weigh in on the role that dietary gluten may play in hair loss among people with celiac disease.
Hello, everyone, and thank you for joining the Blend podcast. Welcome to all of our advanced practice providers, physician assistants, nurse practitioners, and physicians in dermatology, and any other specialties who want to learn more about integrative dermatology. We really hope that we're able to provide some unique insights about what is up and coming in integrative dermatology. JAK inhibitors are one of the talk of the town. I've had some great results in the patients. I've been able to get it through the insurance if I ever can. So what has your experience been in incorporating them in certain scarring alopecias? How often do you use them? Any problems you've often run into? And then please take it from there and talk about all the other common therapies and however you want to educate us about it.
Yeah, I think JAK inhibitors are really a game changer. I think there have been in the last 5 years some big game changers in the hair loss world, and I do use them. I do have conversations with patients about them. And I have had a number of patients who are afraid of them because of the impact on potential suppressing immune system in some ways. They read the box labels on any of these drugs, and it's terrifying. But most people tolerate them quite well. I have one of my favorite cases is a woman who had very extensive alopecia areata, not quite universalis or totalis, but loss of almost all of her scalp hair, like probably about 70% of it, with wide plaques. And we had done injections and, all of these things. Baricitinib is one of the JAK inhibitors, came on the market, and she was gung-ho to try it. She's a mom of 5 children in her 40s. And she got on it. And that fall season, she was sick all the time. And she was very afraid, like, well, is this because of the JAK inhibitor? She's just somebody who's very, very exposed to a lot of bugs. And I do think that it impacted her immune system. And so this is one of the things that I love about integrative. So we talked about it, and she's like, I don't want to give this up because I'm, my hair is really important to me, and I've gotten full regrowth and I'm really happy with it, but I don't want to go around being sick all the time. And I worry about that. And so we worked on some integrative approaches to help optimize her immune system. And we talked about some of the risks. We talked about, like, well, these are little colds and sniffles and flus that you're getting. There is a risk that you could get a more serious infection at some point. But we're doing the lab monitoring, and and I got her on an elderberry zinc supplement, and the next flu season, nothing, completely healthy. So by helping her manage that kind of side effect, and I don't think they cause severe immunodeficiency in people who have a generally robust immune system. I think it can cause a little bit of a dip. But in this case, we were able to kind of allow her to stay on this medication that was incredibly helpful for her. And that's very, very rewarding when you can offer somebody, she came in and gave me a huge hug the next time and was like, thank you so much, because, this suggestion that you gave me really, really worked. And now I can stay on this medication that's helping me in this important way. So that's really the beauty of integrative dermatology to me. I do have a older man who's just recently retired, and he's in an interesting position because he looks like he's headed towards alopecia totalis. So he's got big patches on his legs, under his arms, on his scalp, on his face. He's very afraid. And I've been trying to encourage him to go along. We've had conversations. What does your hair mean to you? He's a man. He's like, if I were a woman, I'd probably be on the drug already. But I'm a guy. Guys go bald. And he's just kind of waffling back and forth a little bit. We had a really interesting thing happen, and this is a recent patient of mine came in last week. He had gone to Italy. So he decided he was going to go on the JAK inhibitor. We got it approved by his insurance. He has the bottle sitting at home. But he didn't want to take it before he goes on this big trip to Italy. And then he had 2 weeks up at his cabin in the north. And he was thinking, when I get home, I'll start taking it. He's in Italy for 3 weeks, visiting family, eating all of the great food there. He started having regrowth in some areas. So he came back, he said, doc, I don't know, maybe I won't go on this. He's still losing in other areas. So he's kind of one of these people that's overall stable, but he's having regrowth on the scalp. He's also having a new patch on the scalp. So he's kind of in this place of it's not like he's just on a downward trajectory completely. So we had a conversation. I said, there is some data that people with celiac disease, when they go on gluten-free diets, they can regrow their hair. It's alopecia areata specific, and it takes looking at a celiac panel. And he, for some reason, was like, well, I'm seeing my doctor in 2 weeks. I'll talk to my doctor about the celiac panel. He didn't really want to go that route. He's not having any GI symptoms, but the gluten in Europe the flour is completely different than the gluten here. And so I said to him, like, this is interesting to me, because even if you don't test for celiac, you might be one of these folks. And one of the interesting things about gluten, he loves pasta. And he's like, I don't know if I really want to give that up. But he also noticed that when he came home and had spaghetti, he felt like there was a lump in his stomach. And when he was in Italy, he was eating spaghetti for every meal, and he didn't have that same bloated kind of feeling. You can purchase imported pasta that's made from Italian wheat. They, on the other hand, cannot buy our wheat, because our wheat is illegal over in Europe because of all of the genetic modifications. But you're going to pay a little bit more for it. But you can also buy flour that's imported from Europe that doesn't have the same the same GMO, like, all of the kind of stuff that we've bred into our wheat to make it more hardy. And so I think gluten is one of these things that often gets villainized. And I think sometimes that's appropriate for the certain patients, but there are also ways of managing gluten where you don't have to go completely off of it. And that's a topic that we hear a lot in general in dermatology. And I suspect other fields of medicine hear it too, like gluten is evil and everybody goes on these gluten-free diets and it's supposed to heal everything if you just avoid gluten. And that's just not true. And there are a lot of foods that contain gluten that are really good for us. And if we avoid those foods, actually, there was a study out of NYU now many years ago, I can't pull it off the top of my head, that found that people who don't have celiac disease, who go gluten-free because they want to, actually have an increased risk of cardiac events, because I think we're missing out on some of the B vitamins with whole foods, with whole grains. So this isn't white flour, it's not Wonder Bread I'm talking about. I'm talking about, the bulgur and the farro and the buckwheat and those kinds of grains that do have some natural gluten in them. So I think gluten can be a little bit of a tricky, touchy subject. And for this person, we're going to explore this. He's very curious, and we're kind of going to look into it a little bit more, but interesting.
I mean, that also reiterates the fact that there is a connection between gut and hair.
We hope you enjoyed this episode of The Blend. Thank you for listening. We'll see you back next time.